Hi, everybody. It's Ms. Mills, and today I'm going to have the cover article from Time for Kids. Call to action. People around the world are finding ways to help during the COVID-19 pandemic. We're going to have that article read to you here in just a moment. This is the front cover, and here it is. And I'm going to let the reader read it to you.
The coronavirus pandemic is affecting people all over the world. In the face of this global challenge, governments are working to stop the spread of the virus. People are doing their part to support healthcare workers and lift spirits. Here, Time for Kids looks at efforts in 4 of the countries hit hardest. These actions show us the power of kindness and cooperation. China. No country has taken more extreme steps to stop the spread of the coronavirus than China. The outbreak began in the city of Wuhan. That was in December. After nearly 11 weeks, China ended its lockdown in Wuhan on April 8th. Chinese billionaire Jack Ma has been doing his part to help others. He has sent supplies to people in Iran, Italy, Japan, and other countries. In March, he donated 500,000 test kits and 1 million masks to the U.S. Speedy and accurate testing and adequate personal protective equipment for medical professionals are most effective in preventing the spread of the virus, Ma said in a statement. United States. The U.S. has the world's highest number of confirmed coronavirus cases. At press time, it had nearly 600,000. This could push the healthcare system past its limits. In New York, thousands of retired doctors and nurses have stepped up to volunteer. The federal government is also taking steps. In March, Congress passed a $2 trillion bill. The bill will help people who are out of work. Ordinary people are helping too. They're delivering food to the elderly and giving thanks to medical workers. You are extraordinary, reads a message in chalk outside a hospital in New Orleans, Louisiana. Italy. Until mid-April, Italy had had more deaths from COVID-19 than any other country. It has one of the largest percentages of people aged 65 or older. Older people with the virus are at high risk. On March 9th, the Italian government declared a nationwide lockdown. The spread of the disease has slowed since then. Now Italy is testing more people for the virus. This makes it easier for health officials to decide who should get quarantined. People are following orders to stay home. To cheer them up, musicians have been performing from balconies. They fill Italy's empty streets with sound. Videos appear on social media. One post reads, "Italians, always making the best of the worst. How can you not love them?" Spain. Spain ranks second in COVID-19 cases behind the U.S. Data from April 13th showed about 170,000 infections there altogether. Many of the people infected were doctors and nurses. Like other countries, Spain did not have enough equipment to safely treat patients. On March 14th, Spain's government told people to stay home. People have been leaning out their windows at night. They clap for healthcare workers. Twitter user Carlos de Clos posted this message: "You are heroes. You are what solidarity looks like. And I hope that solidarity is what's most contagious these days."
Okay, and that was the article. I'm going to go ahead and go look at some of these pictures and captions. If you look at this one, it says checking in. A volunteer registers an elderly person at a hospital for COVID-19 patients in Beijing, China. And then this one down here, it says people in Barcelona, Spain make face masks for use in hospital and nursing homes. And down here it says, sweet melody, an accordion player serenades her neighbors in Milan, Italy in March. These are the power words. Quarantine, it's a verb and it means to restrain a person or people's movements to stop the spread of a disease. And then the other one is solidarity, which is a noun, and it's a feeling of unity or of having the same goals. This is a picture of workers preparing free lunches for the elderly at a restaurant in Louisiana, here in the United States. So This article was written back in April 24th, so it's a couple weeks old, but some of the same things are still happening today. Thanks for taking your time with me today, and I hope you enjoy the rest of your day.